Good afternoon, everyone, and thank you for joining me today as we give the COVID-19 pandemic update here in Erie County. Today we have 39 new cases to report with one additional death. Since last Wednesday at this press briefing, we've had an additional 353 new cases of COVID-19 in Erie County and one additional death. As of this morning, we have 15 hospitalizations total within Erie County at our hospitals, and one person is on a ventilator in those hospitals. The positivity rate for Erie County was 6.6% from April 2nd to April 8th, according to the Pennsylvania Department of Health. I have a graphic that is going to be put up right now to show where we're seeing the trending of the cases here in Erie County. As you can see from this graph, we are trending to see the virus is trending in younger generations, in the younger portion of our population, much more than seniors. As you can see at the far right hand of the graph, those 65 and up, we're seeing very few cases in there. And of course, that's because many of those people were in the first phase of vaccination opportunity, and many people who are 65 and up took advantage of that and got a vaccination here in Erie County. So what that shows to us is the vaccine actually does work, and now that vaccine is opened up for all in Erie County as of yesterday, all in Pennsylvania are eligible to go get the vaccine. I hope that we start to see the numbers falling in all age groups as we have in our most elderly age groups. We have a 32.5% of those eligible in Erie County have received at least one dose of COVID-19 vaccine, and actually I'd say that's pretty good. So we want to see those that percentage continue to increase till we get to that point of herd immunity, which still is a ways off, but thank you to all who have taken the step to get their vaccine. So I want to encourage everyone to do that. The data proves that it's having a positive impact on our community and stopping the spread of COVID-19. I also want to encourage you to get tested if you have any symptoms or if those you love have any symptoms. Testing is still a very important tool in mitigating the spread of this virus. We have the mobile testing unit out now from Erie County Department of Health, launched with the LECOM Institute for Successful Aging. And it will be tomorrow at the Wattsburg Area School District building from 4 p.m. to 8 p.m. So a great opportunity late afternoon and evening for those who live in that area of the Wattsburg School District to go and get tested. Saturday, April 17th, the mobile unit from 10 a.m. to 2 p.m. will be at the parking lot D at Presque Isle Downs and Casino. And then next Monday, the 19th, it will be at Green Township Building from 10 a.m. to 2 p.m. And you can find the schedule for this mobile unit at eriecountypa.gov. And as always, continue to find reliable sources of information on whether it's testing, vaccination sites, so many other things at our website, eriecountypa.gov, or websites such as the CDC's, the Pennsylvania Department of Health, and Johns Hopkins. And speaking of reliable sources, I'm pleased to welcome back our hospital partners today with me on this press briefing. And now to share some updates, I'd like to start with Marcus Babiak, the Chief Operating Officer at Mill Creek Community Hospital. Are you with us, Dr. Babiak?
I am.
Thank you.
Good afternoon. Thank you, Kathy. Currently in Mill Creek Community Hospital, we have one COVID positive inpatient, but we have seen a recent trend in an increase in the number of COVID positive patients who are seeking services from the hospital. We continue to implement all precautionary measures, including limited access to the facility, temperature taking, and screening to protect both our patients and our staff. To date, LECOM Health has administered almost 30,000 vaccines to the community. LECOM Health is committed to ensuring that every individual who wants to be vaccinated against the COVID-19 virus is able to be scheduled for an appointment for the vaccine. We continue to have an average of 3 first dose clinics a week, not only at the Bayfront Convention Center, but also at other locations throughout the community. We have the capacity to administer over 2,500 shots per week. But with this capacity, we are continuing to see a decreased demand for vaccine from the community. We now have first dose appointments, which remain vacant. We are continuing to schedule first dose appointments throughout the remainder of April and through the beginning of May through our online scheduling tool and through our call center. If you'd like to receive a COVID-19 vaccine, you can either visit lecom.eventbrite.com or call 1-866-LECOM19 to schedule an appointment. All first dose appointments will be confirmed with a phone call within 72 hours of the appointment for the scheduled time. Additionally, we request that if you have a scheduled appointment and you cannot keep your appointment, you either call us at 1-866-LECOM19 or email us at vaccineinfo, that's VACCINEINFO, at lecomslc.org, and please notify us that you are unable to keep your appointment. At LECOM Health, we provide a whole person lifelong patient care and continued our deep commitment to enhance the health of the community through service. Again, if you'd like to receive the COVID-19 vaccine through LECOM Health, we have vaccine appointments available as soon as Monday, April the 19th, which can be scheduled through our online scheduling tool at lecom.eventbrite.com or by calling 1-866-LECOM19. Thank you.
Thank you, Dr. Babiak. And now I'd like to go to Dr. Chris Clark, who is the president and CEO of AHN St. Vincent Hospital.
Thank you, County Executive Dahlkemper. Good afternoon, everyone. I am grateful to provide a report on our status at AHN St. Vincent. Overall, we are definitely seeing a lower number of COVID tests performed and hospitalized patients compared to our peak back in December. As a reminder, our average COVID patient daily census was 54 in December. It has substantially declined since then to 14 in February, 9 in March, and so far 5 in April. Today, we have 6 patients in our specially designated unit. Over the last week, we are starting to see a slight increase, though, in the number of patients with COVID in the hospital. We do recognize a moderate uptick in hospitalizations at the other AHN hospitals in Pittsburgh, so this is definitely something to keep a close eye on. We are also seeing a decrease in the age of patients requiring hospitalization. So since this first started, about 70% of our patients hospitalized are greater than 60 years of age. Since March, that rate has decreased to just a slight majority. And we've seen more admissions for people in their 40s and 50s. With the exception of 2 patients, all of our hospitalized COVID patients have not been fully vaccinated. We continue to make great progress in offering vaccinations to groups and patients as directed by the state. As everyone knows, this week we were able to start scheduling anyone 16 and above. We are still exclusively using the Pfizer vaccine at AHN St. Vincent. We have not used any Johnson & Johnson supply. We've offered access on our hospital campus in the McGarvey Center and at outreach sites to include the Erie Insurance Arena, Booker T. Washington Center, and in Union City. We are planning another event at the MLK Center this Saturday and are currently exploring other sites in the county. We've been pleased to execute these community events in partnership with the County of Erie and the Health Department. Our focus at this point is to address the hesitancy that exists in receiving the vaccine. We know that it is safe and effective, which is now our personal experience after administering over 42,000 doses as of today. We still have openings in our schedule for tomorrow and in the weeks to come. Patients may schedule via our website, ahn.org, AHN MyChart once you have an account, or by calling 814-CONNECT. And then finally, let's continue to promote social distancing and wearing masks to protect the most vulnerable, particularly those that have not yet been vaccinated. County Executive Dahlkemper, thank you again for the opportunity to speak this afternoon.
Thank you so much, Dr. Clark. And now we'll go to Mr. John Gennaro, the director of Erie's VA Medical Center. John?
Thanks again for having me today. The Erie VMC is currently offering COVID-19 vaccinations to all veterans of all ages, including veteran spouses, veteran caregivers, and those who have CHAMP VA recipients. This includes veterans who are not enrolled in VA healthcare. Interested individuals can sign up either online using the VA Keep Me Informed tool at erie.va.gov, or they can call 814-868-8661 and press 2 to schedule the COVID-19 vaccination. Out of abundance of caution, the Erie VMC has temporarily paused the administration of the Johnson & Johnson COVID vaccinations based upon CDC and FDA recommendations. It's important to note that reported events from J&J are extremely rare, and similar events have not been reported with other FDA authorized vaccines, which have been administered to millions of folks across the U.S. The pause in the use of the J&J vaccination is a good example of intensive safety monitoring, high reliability system transparency, and proactive intervention. We have available the Moderna vaccination, which has proven to be safe and effective. As Dr. Clark said, if you're hesitant about getting the vaccination, I encourage you to have a conversation with your provider and make the best choice for you. For me, I chose to get the vaccine, not only to protect myself, but my family and my coworkers here at the Erie VA and the community. As always, I encourage veterans to reach out to the Erie VMC for any of healthcare needs or questions. Thank you.
Thank you so much, John. And now we'll go to Emily Shears, the Director of Operations at UPMC Hammett. Emily?
Hi, good afternoon, everyone. Thanks for inviting us to participate again today. To begin today, and in support of the recent Pennsylvania Department of Health expansion of the COVID-19 vaccine eligibility, we also want to encourage all Pennsylvania adults to schedule appointments at vaccine.upmc.com or by calling 844-876-2822. UPMC Hammett has COVID-19 vaccine appointments available immediately and in the future. To date, in Erie and across the communities we serve, UPMC has given more than 364,000 vaccine doses, and we are thankful and proud to say that we have been able to administer nearly 50,000 doses right here in our community. When supply is available, UPMC Hammett is able to administer between 5,000 and 8,000 vaccines a week, and we have the capacity as a system to administer 100,000 vaccines each week. We also have positive news to share today. Welcome news at a critical time with a rise in the COVID-19 cases and the emergence of new virus variants in our area. We want the community to know we have a robust treatment option for individuals that test COVID-19 positive. Our data has shown that treatment with monoclonal antibodies have kept our patients with COVID-19 from needing to be hospitalized, potentially sparing them from long COVID-related disabilities and even death. Monoclonal antibody treatment is an infusion given in an outpatient setting. If you qualify for the treatment, our data shows it cuts the risk of hospitalization and death in our patients by 70%. This treatment can be given for mild illness in order to prevent later severe illness. Don't let cost be a barrier. The medication is free, and the UPMC health plan waives all fees for our members, as many other insurers do as well. Please contact your physician and ask about this treatment for yourself, your family, your friends that have tested positive for COVID-19. The current increase in COVID-19 cases is likely driven by the emergence of new mutations and variants, and such as the more transmissible UK and California variants, which may be more likely to cause severe disease. So we urge everyone to stay diligent with the masking and distancing and make sure they sign up today for a vaccination. The Pfizer and Moderna vaccines, as mentioned, are safe, and complications noted yesterday with the J&J vaccine have not been reported in either the Pfizer or Moderna vaccines. Vaccination is vital to stay safe from life-threatening effects of COVID-19 and to keep people in communities safely together. COVID-19 vaccination is a critical component of our virus spread mitigation efforts, which must still include masking, distancing, and hand washing. We want to remind you that UPMC remains an extremely safe environment, so seek medical care should you need it. Please continue to follow all of the mentioned prevention efforts to help our community continue to stay safe and protect those that are most vulnerable. Thank you.
Thank you, Emily, and thanks to each one of you and your teams for all you're doing to keep our community healthy and safe. And now that the vaccine is available for any person 16 and older in our communities and in this Commonwealth, you've heard that there is vaccine available. It's available now, it's available next week, it's available for you and for your family and loved ones. And I do encourage people to not hesitate, but instead go out and get vaccinated. Now we're going to turn it over to the media for questions, and we're going to start today with the Erie Times News. David, are you with us?
Yes, I am, Kathy. Thank you. I have a question for the hospital folks. With large-scale clinics today and yesterday, have you seen an increase in people registering since it's been open to everyone 16 and older? And if so, how much? And has it been what you expected in terms of more people signing up?
Who would like to go? Emily?
Hammett, we have seen about a 20 to 25% increase starting yesterday. So we likely will continue to see that.
I'll go next. Yeah, it's about the same for us too. For the rest of this week, we have a few remaining appointments, and then it increases in availability and capacity in the coming weeks. But there's certainly still an opportunity for more people to sign up.
I think you're on mute, Dr. Babiak.
Thank you. And I will echo what Emily and Dr. Clark said. We have seen a slight increase in the number of registrations, but we still have appointments available. So anybody who would like to receive the vaccine, we do have the opportunity and the capacity to vaccinate you.
And likewise at the VA, we began vaccinating all veterans of all ages about 3 weeks ago. And so there has been an uptick in requests for vaccinations, and we do have plenty of the Moderna vaccination in stock and available for folks.
And just to follow up with any of you that want to comment on it, is the 20 to 25% increase about what you expected, or is it less or more than what you expected?
It's about what I expected for sure. And no surprises. I mean, it wasn't a dramatic increase, which I think I talked to you about recently, David. This is really to be expected, that it's just a slight increase right now, because I think all the health systems have done a great job to provide access to this point. So no surprise from my end.
And I think the distribution and access to the vaccinations has caught up with the demand, and that's a very good thing. So I think across all Erie County, all residents will have ample opportunity to get the vaccination, and encourage all to do so.
All right, thank you. We will go on now. We'll go on to Joel at Talk Erie.
Yes, good afternoon, folks. Appreciate it. This is for the healthcare providers as well. To kind of follow up on David's question, the acting Secretary of Health issued a statement this week reminding residents to cancel appointments if they've made multiple appointments and just need to keep one. Can you describe the level of no-shows you're seeing at your vaccine clinics, and how easy is it to cancel an appointment?
Yeah, I'll take that one first. And Marcus talked about this in his talking points. I think this is, Joel, incredibly important for all of us, since there is an increase in the access points to receiving the vaccine. There is a likelihood that people have scheduled in multiple locations. So we definitely need to emphasize this point, that people that have, for whatever reason, either more than one appointment or cannot make their original appointment, that they should call each of our health systems and cancel. From my end, it's calling 814 Connect. That's one way to do it for sure. They can also do it on my chart. But our no-show rate has gone up slightly. And that is something that we're concerned about, that will continue to go on. And it is something all the health systems need to keep a close eye on.
And Joel, from our standpoint, our no-show rate right now is about 10%. It was so significant that, I did have to feel like we should include it in our talking points. Originally when there was not enough vaccine available to meet the demand, everyone was encouraged to schedule multiple appointments. But now that there's ample vaccine available, if you have an appointment scheduled, we will have vaccine for you. There is no need to be scheduled for multiple providers. So if you do have an appointment with us and you do not intend to keep it, please let us know, so that way we can have that vaccine appointment available for someone else who intends to get the vaccine.
And I would echo those comments from the two previous speakers. We would ask that you call our 1-844 UPMC VAC, which is also 1-844-876-2822 to cancel. Again, for the various reasons as mentioned, we will not open an appointment unless we have vaccine. And so just be aware that, as mentioned, if you need a vaccine appointment, you can be assured you will receive it with us.
Thank you. And now we'll go to Erie News Now.
Good afternoon. A question that really could go to any of our healthcare professionals, but Dr. Clark, I'll bother you with this one. Are we already at the point of seeing this become a demand problem and not a supply problem? And if so, how concerning is that, knowing that we have more than people are asking for and that 2/3 of the county still hasn't even received one dose?
Ethan, I think we are getting very close to that at this point. The true test is the time period we're in right now, since it has been opened up to 16 and older. But we're all promoting the fact that we have access to openings in our schedules, and it's just been 48 hours, but I think we have an issue with demand at this point. So I think most of us talked about it in our talking points, that there's hesitancy out there. We're seeing hospitalizations with unvaccinated people, younger people included. So we need to promote the importance of taking advantage of these slots that we all have available. And we really want to see people get vaccinated so we can get past this pandemic.
And Doctor, how much do you worry about the possibility of another surge here? Are we in a window right now where the more needles we get, the more we're really racing here, and every needle in every arm is a chance to prevent another surge?
That's exactly what we're trying to do. This is a race against the variants that Emily talked about in her talking points. We know that other states and also other parts of our state, like Pittsburgh, are seeing increasing rates of hospitalizations, and it's younger people. So that it's definitely very, very important, and our community needs to protect itself. And the way to do it is, of course, follow the guidelines of social distancing and wearing masks still, and get vaccinated.
Thanks.
Thank you. And we'll go to Jet TV.
Hi, Kathy. It's Brian Wilk. My question may go along with the lines of you talking about how the virus is trending at an alarming rate with younger people. Since there's like a rise of COVID in Erie, are any of those people maybe fully vaccinated? Maybe they think they're invincible to COVID, when in fact that the vaccine only just lessens your chance of getting the virus?
So we're not seeing these cases in people who have the vaccine. We're seeing these cases in people who have yet not gotten the vaccine. And the great news yesterday that the vaccine was opened up now to all residents 16 and older makes the opportunity there for people to be able to go and get the vaccine. I think, to the point others have made, we need everyone who's eligible, that would be 16 and up at this point, to find their way to one of these great providers or some other provider that's out there to get a vaccine and get it as quickly as possible, because again, this is a race against time with the variants out there. But it is not people who have the vaccine that are getting sick and again, spreading the virus as much as it is people who have not yet had the opportunity.
Got it. And can you maybe reiterate how important it is, or you said younger people trending at a younger rate, and you hope that those numbers will go down now that everyone can get the shot?
Well, I think when you looked at the graph that I had put up earlier, when you look at the 65 and up levels, they're very, very small in compared to all of the other age groups there. And you can see that it is teenagers, 20-year-olds, 30-year-olds who have the highest percentage of the cases we see here in Erie County at this point. So the vaccine was really only available for the older population or people with pre-existing conditions who tend to be a little bit on the older side. So that's who we believe got the vaccine, early on. And unfortunately, the teenagers and the 20 and 30-year-olds weren't able to get the vaccine, but now they are. And so that's where we need to really make the push for those who weren't eligible until yesterday to go out and get the vaccine. I'm going to tell one story that was told to me today, which was quite heart-wrenching. And I was on a state call with colleagues from other counties, and one of the county commissioners, who I'm not really sure how old he is, but I'm going to say I think he's probably in his 40s, said his wife didn't even realize she had COVID-19. She was one of those asymptomatic, and she got what they called COVID toes. And then he went on to say that she may lose her toes. She's still struggling with this. And we were talking a little bit about this long hauler syndrome. So this is a very serious virus. Many people have died from it, but many people who haven't died are still dealing with the symptoms of it. And that is something that should give everyone pause who may be questioning whether they should get the virus because they're younger or because they're just not sure about the science. I think that they really need to do their research and look at the effects of this very, very dangerous virus. Thanks, Brian. We also have we have West County Journal with us today. Sandy?
Yes, I'm here, Kathy. Thank you. I think this may be more for you than the medical professionals. We have some good news in West County that Dan Rice Days and the Albion Fair are proceeding with plans to have their festivals this year. What are your thoughts on that? Do you think that's a good thing, or are they rushing it, or, what do you believe?
So we're all trying to get back to some semblance of normal, and I think there's obviously good in being able to finally gather with other people for our mental wellness, as well as maybe just community health in general. There is an event checklist that every event is encouraged to utilize, which is from the County Health Department, our environmental division. They are working with pretty much any event that is happening in Erie County to help them be safer in holding the event. We're not approving or disapproving, but we're trying to help each event be as safe as possible going forward. And I think each individual needs to decide for themselves about their own feelings of risk going into a crowd. That's obviously, if you haven't been vaccinated, definitely wouldn't recommend going into a crowd. If you have any kind of serious pre-existing condition, some of those things you might want to really wait until more people are vaccinated. But the Albion Fair is late. It's not until September, if I remember right. That hopefully by then we will have a great percentage of our people who've been vaccinated, and that will keep everyone safer. So I guess go back to the fact that if you don't want to get the vaccine for yourself, get the vaccine for our community, get the vaccine for everyone else, so that we can all get back to getting out and enjoying the wonderful events and the wonderful things that happen in Erie County.
Thank you.
I'll go back to David at the Erie Times News.
Sure, Kathy. Thank you. This question's for you. What will the county health department do now? Dr. Clark said this is now a demand problem. I know there's been plans and discussions about what kind of outreach the county and the county health department can do about that. What is in action now? What are some specific things that we can expect from the health department over the next couple of weeks to help spur people to get vaccinated?
Well, obviously, we're going to continue to work with all of our great partners who are out there vaccinating and making sure that information is given. I was at the graduation for our community health workers at our neighborhood centers this week. One of their jobs is to get out into the community because they are a trusted individual within those communities. Often government telling people to go get a vaccine is not as successful as people one-on-one talking about this. So we're going to encourage everyone to tell their friends, their neighbors, their family members about how important it is. And honestly, the 4 partners we have on here today, the medical profession is key to informing the community why it is important to get the vaccine. Often, the person in the white coat, the trusted health provider, is the personal physician of the individual is a much more trusted source than government when it comes to these type of things. So we've got to continue to hone our message, and then obviously the message coming from the federal government and the state government needs to all be aligned, which I believe it is. And we have talked about a lot about the fact that the message really needs to come from trusted individuals in specific communities, and that's what the messaging needs to, I think, really align more with.
And to follow up on that quickly, we've seen some more remote vaccination clinics. Can we expect more of those in the coming weeks, trying to bring the vaccine to the people of Erie County?
Yes, and we are working on that too. Thanks for bringing that forward, because we are working on the fact that, vaccines will be much better, I think, accepted if it's in their own community, instead of asking people from, Albion or some other, Elgin to come into center city of Erie, get vaccine clinics out into places like that. We had a vaccine clinic recently at Corey, I believe, in Union City. And so having those vaccine clinics in those communities is really helpful in terms of reaching people. So we will continue to do that, as well as the testing. So the testing units are getting out there, but we are looking at where we need to really hone in on vaccine clinics, maybe where they only have a drugstore, for example, a pharmacy in their community. How can we bring a clinic in through one of our partners and get that going in that community? So we are working on that. And we'll go to Joel at Talk Erie.
Yes, County Executive, this one's for you. Does the county health department have a handle on how the COVID testing, reporting, and contact tracing is working with the migrant children at the dorms in Summit Township? What's that information flow?
Shar is with us today, and I failed to mention that, Shar Behringer, and she's had some conversations around this. So if you're okay with that, I'd like to turn that over to Shar.
Sure.
Thank you, County Executive. The whole process of bringing in the migrant children has been a federal process. We at the County Health Department are not directly involved with any of the care that they are receiving in any way. We were contacted early on when the possibility arose that a large number of children would be arriving in a short period of time, and they were requesting things like childhood immunizations, COVID vaccines, things that we are not prepared to offer out of the County Health Department with staffing the way that it is. So when that community contact called me, I encouraged them to find a vendor in the community who could handle a large number of children in a shorter period of time. Again, they just came in last night, so we certainly would not have test results back and reported through our electronic reporting system at this time. Thank you.
A quick follow-up, Shar. Do you anticipate that any positive tests would be attributed to Erie County numbers?
It's certainly a possibility. They were living in close quarters. They were transported in close quarters. We know that those are situations that are conducive to disease spread.
Thank you.
Thank you. Erie News Now. Back to you, Ethan.
Hi. Question for either of our doctors. Doctors, is there any reason to think or hope that a possible fourth surge might result in a lot more cases, but fewer hospitalizations because we vaccinated so many older people who are more at risk? Or do the variants flip the script on that and kind of throw out the initial thinking that this was a virus that predominantly had serious effects in older people?
Ethan, if I understood your question correctly, we've already commented on that we're seeing younger people in the hospital, and definitely our experience is that we, for the most part, are taking care of in the hospital for COVID unvaccinated people. So it doesn't mean that those people that are being cared for by all of us can't get very sick with this. So we have seen deaths even in young people in their 40s and 50s because of COVID. So now you tied in the relationship with the variant strains that are out there. We know that younger people are more at risk for having the variants, strain and spreading it, but not necessarily does that put them in any greater risk for getting sicker with it. So, and then the other experience that we're having is because we think that we started with vaccinating older people, that's why we're seeing less hospitalizations of older people, because the vaccine has been protecting them. So that's the strongest message that we're putting out there today, is that, you know, those that haven't been vaccinated should get vaccinated, because we're seeing evidence that it prevents hospitalizations. So hopefully that answers your question. I definitely want to make sure that, you know, it's recognized that people can get very sick still with COVID, including younger people. But that's why this is a race against time in addressing the opportunity to get vaccinated and preventing the spread of this disease.
Thanks. That's perfect. Appreciate it.
Thank you. We'll go back to Jet TV and Brian.
Yeah, my question is for, I believe it was Dr. Clark made the comment, says that there's still a big hesitation with people actually getting the shot.
Brian, you were asking if the hesitancy question about in receiving it?
Yes.
It's a real issue for sure. That's what we're up against. I think we're transitioning as we speak to having more of a demand problem than compared to when we were talking about vaccinations, where it was more of a supply issue. So we want to promote its safety and efficacy for sure. Our experience has been very good. You know, we haven't been asked directly about side effects this time, but very minimal side effects. No, we haven't had any hospitalizations, fortunately, of anyone that's been vaccinated for as a result of the vaccination, I should say. So very well tolerated. It's safe. We know what we're hearing about with the Johnson & Johnson product. Hopefully that's something we can get past, and the FDA is able to recommend its use in the future. We'll wait and see. But and Emily mentioned this with the Moderna and the Pfizer products, they're extremely safe. We haven't seen those side effects that we're seeing in a very small amount of people with Johnson & Johnson. So we need to continue to move forward with vaccinating as many people as possible.
Thank you.
Thank you.
And back to Sandy at West County Journal.
Okay, my question is sort of bouncing off of that. Do you think people have been reluctant to get the second vaccine after they got their first? And how big of an issue is that if they just say, I'm one and done?
Dr. Babiak, do you want to speak to that from what your experience has been?
Sure, absolutely. At this time, we have not really seen any hesitancy for getting that second dose for somebody who has already gotten the first dose. A vast majority of the individuals who have received their first dose through us have shown up for their second dose clinic. That hesitancy with which Dr. Clark is referring to is with getting that first dose and starting that vaccination process and not in the process of completing it.
Emily, do you have any other thing to share on that from UPMC?
Yeah, we have not seen an issue. Usually when someone initiates the vaccine process, they do follow through with the second dose. We have had some feedback that people were holding out for the J&J vaccine. We want to encourage people to seek the Moderna and Pfizer vaccine. Again, they are safe, reliable. We keep saying that over and over. And younger populations, while many do have mild to moderate, there are those that can have severe illness, as mentioned, and potential side effects that we're still learning about in terms of the long distance impact of COVID on a patient's body. So please get vaccine. That's available in our communities, which again is right now the Pfizer and Moderna brands.
Thank you.
Thank you.
And we'll go back to David. Do you have a final question?
Sure, Kathy, thank you. And this is for the hospital providers. I know in recent weeks what J&J vaccine we've seen in the county has been directed toward SCI Albion, Community Health Net, and I believe some of the chain pharmacies. Have any of your organizations received any J&J vaccine in recent weeks?
This is John at the Erie VA. We have received J&J vaccination in the recent weeks. In fact, our primary source, though, is the Moderna vaccination. So about 5% or so of the population has received the J&J vaccine. And as stated, the small and rare side effects, 6 in over 6.8 million vaccinations, the side effect occurred in. So currently, all veterans, caregivers can receive the Moderna vaccination. As soon as we found out about the recall or pause with the J&J vaccination, we immediately pivoted. And I think our staff, and I know the healthcare providers on this call, that's what we do in healthcare, is pivot and learn and take the opportunity to respond in the name of safety for those we take care of. And we immediately switched any of our future appointments or vaccination clinic that were utilizing J&J to Moderna.
And John, roughly about how many doses of J&J were you scheduled to give out in the next week or two that you've had to hold back because of the pause?
I don't have that number necessarily offhand. It was probably less than 100. And we reached out to those individuals, and the vast majority have rescheduled with Moderna vaccination, so they're still willing to get the vaccination.
Thanks, John.
You're welcome.
And Joel with Talk Erie, do you have a final question?
Yes, this might be for Shar again. Shar, where are we seeing this recent rise in the last 7 to 14 days geographically? Is this a city issue, suburban issue, or a rural issue in Erie County?
The disease is all over the place, Joe. Really not centered in any one location, urban, rural. It's really all over the county.
Okay. So there's not going to be any like action points to maybe kind of dive in on clusters, you don't think?
Not at this point in time.
All right. Thank you so much.
Thank you. And Erie News Now, Ethan, do you have a final question?
I do. A question for everyone on the call. Now that vaccines are available to everyone, and as we discussed, vaccine hesitancy, have all of you been vaccinated, or at least signed up to be vaccinated?
I'll start with I have been vaccinated. I'm a yes.
I'm a yes.
I'm a yes. I was vaccinated early on with Tier 1A. Absolutely.
Likewise, it's John. Yes.
And this is Marcus.
And
Absolutely,
Shar,
I've
yes
been.
also.
And Marcus, absolutely, I've been vaccinated fully.
Thanks.
All right. We're all yes. That's good. And now we'll go to Jet TV. Brian, do you have a final question?
Sure, yeah. If you could reiterate, you mentioned how important it is to, there's been, some vaccination clinics going out to rural areas because a lot of those people might not have the transportation to come into the city to the hospitals. So how did you say there's going to be more rural clinics in the future you're planning for?
We are looking at continuing to expand that. All of the clinics that we have available and know of, you can find at eriecountypa.gov. And I know that there's other, I think your own station has that resource. I think I've seen that on your news reports at night. So there are ways for people to find out. And if you can't get online and you still want to know, you can always call the health department at 451-6700. If you're struggling to find out where near you or when near you there will be a vaccine clinic, because we want to get the vaccine close to the people, and this will happen more. In the beginning here, we've been doing larger clinics, which obviously is very efficient, get a lot of people through, but as we start to find the people that are struggling a little bit more to get the vaccine, it's best to get the vaccine close to those people's homes so that they can have better access. Thank you.
Thank you.
And we'll end with Sandy at West County Journal. Do you have a final question, Sandy?
How about we talk a little bit about the younger kids that are, getting it more? Is it because of the vaccine that hasn't been available to them until now, or do you think it's a combination of that? Maybe they're not social distancing like they should, and are a little bit more lax and take precautions?
Well, I believe it's both. I believe, first of all, they haven't had the opportunity to get the vaccine. And of course, if they're under 16, they still don't have the opportunity to get the vaccine. And so many younger people have not been vaccinated, the vast majority. Secondly, many more things have opened up more. Schools, even the City of Erie schools now are back in school. We don't really see a huge spread within schools, but they're just together. Sports are back up and running, and even though there's precautions taken, we've seen some cases of COVID-19 being spread through sports, and I think we're all weary. We're all weary of the mitigation efforts. We're all weary of not being with our friends and our families and our neighbors, and so people have kind of loosened up. And to that point, it's still extremely important that we all wear our mask, that we wear it when we are outside of our home, whether we're vaccinated or not. And make sure you wear it properly, of course, over your nose and your mouth. But even if you've been vaccinated, you should be wearing your mask, because these vaccines are 95% effective, which means 5% of us who've gotten vaccine could still potentially get the virus or spread the virus to others if we have it. So wear your mask. Keep your social distance, stay out of big crowds. The CDC says if you want to sit down and have a meal with somebody else who's fully vaccinated and you're fully vaccinated, they said that's okay now. But otherwise, you should really be still using the same caution, hand washing, sanitizing of your hands, and the social distancing, as well as the mask wearing. Still very, very important mitigation efforts. This virus is not over. It's still here. It's very present in our community. When you look at our numbers today, they might seem better, but think about where we were even a year ago, where we were last summer, where we were last fall. Our numbers were much lower than they are today. Lots of virus still circulating in Erie County, and we all need to remember that and still use caution and be careful with our activities. Thank you, Sandy.
Thank you, Kathy.
So thank you to everyone who came and joined with me today. Again, we have some great partners in our healthcare systems. We are very, very fortunate in Erie County to have such wonderful healthcare systems, and I really appreciate their counsel and their being here with me today. And I'd like to remind our businesses out there, if you're in the hospitality industry, there still is some money left in what we call the CHIRP program. It is for hospitality industry related businesses. And we would encourage you, if you haven't gotten money from that program, to apply. We've had 116 applications, which has totaled a little over $2.7 million. But again, still a little bit of money left. Go to eriecountypa.gov. Some of our star businesses, we're going to go to both ends of the county. We're going to start with Chico's Travelers Inn in Fairview. Doing lots of good things with markers up on the bar, displaying 6 feet, signs stating masks are required anytime you leave your seat. Prior to the mandate being lifted, they were making everyone purchase food with their drinks, and they clean and sanitize throughout the day. And then going to Corey, on the opposite end of the county, we have Mel's Hometown Restaurant. They have signage in place with COVID measures being taken and additional cleaning efforts throughout their facility. And also doing a great job in Corey is the Taco Bell there. Great food and safety inspection with appropriate COVID measures in place. Cleaning and sanitizing procedures have increased during COVID, as well as signage and masking. So as always, thanks to our businesses. It's been such a difficult year for them to continue to support them in any way that you feel comfortable in supporting them. And again, please continue to use all the mitigation efforts over these next days and months ahead. We have to still wear our masks, keep ourselves socially distanced from people we don't live with, and stay out of crowds if possible. And obviously, if you feel sick at all, do not think it's your seasonal allergies. Do not think it's a cold. First, rule out that if it's COVID-19 or not. If it's not COVID-19, then probably go back to your seasonal allergies or whatever. But go get tested. Make sure that you're not spreading that virus to other people in this community. So over the next week, I ask you all to please stay safe and stay calm. Thank you.
Thanks, everyone.
Thank you.
Bye-bye.